Where was I? Albania lies in the Western Balkans at the Adriatic Sea and is bordered by Montenegro in the north, Kosovo and Macedonia in the east, and Greece in the south. The Health for All project does not work in the whole country, but focuses on two pilot regions, namely Dibër, north of Tirana, and Fier, south of Tirana. A health system can be divided into three levels. A primary or community level, where family doctors and nurses work, a secondary level with hospitals and polyclinics, and a tertiary level with referral hospitals. Among others, one issue in Albania's health sector is that most of the budget flows into the secondary and tertiary sector, whereas the primary sector is neglected. Therefore, the Health for All project focuses on the primary level. SDC launched the Health for All project, which is financed with nearly 10 million Swiss francs, and its phase 1 is implemented from 2015 to 2018 by a consortium of the Swiss Tropical and Public Health Institute, Terre des Hommes, and Save the Children. The overall goal of the project is that the Albanian population benefits from better health, thanks to improved primary healthcare services and improved health promotion activities. So what did I actually do? In short, I did an evaluation of the following project implementation. In 2016, HAP distributed doctors' bags to all 220 family doctors in the two project regions, which each contained 17 basic medical tools, and trained the doctors in the tools' correct use. About 1 year later, I conducted a survey with 40 of those family doctors to answer the following questions. Are the bag and the tools still available and functional? How often do they use the tools? Has the distribution of the bag improved their quality of care? And we wanted to assess the doctor's competence and confidence in 4 key medical procedures. Once the study protocol and the electronic questionnaires were developed, the data collection could begin. On a typical data collection day, we left Tirana early in the morning and traveled to one of the 40 selected health centers. Each data collection team consisted of 2 people. Together with the nurses, one person, who was sometimes me, counted and categorized the patient visits from the patient registry book. This data was used later to calculate the usage of each of the 17 tools. The other person, a contracted experienced family doctor, conducted the interviews using electronic data capturing on the tablet and evaluated the interviewee's competence and confidence in performing the following 4 key medical procedures. Measuring a mock patient's blood pressure by correctly using the stethoscope and the arm cuff. Measuring the pulse and the oxygen saturation by correctly using the pulse oximeter. Examining a mock patient's ear by correctly using the otoscope. And calculating the expected date of delivery of 3 fictive mothers by correctly using the pregnancy wheel. After work, we were often invited for coffee, rakia, and sometimes even given some juicy watermelons from the local garden. Once back in the office, I cleaned and analyzed the data and compiled the study report, which will hopefully inform future project decisions. My lessons learned from the whole project assignment were that international development and cooperation can be very political. HUB, for example, is based on a health reform which was never implemented. That different development organizations can have different priorities which are sometimes difficult to align. And that in a setting where local employees are at risk of losing their rare jobs, they might be afraid of challenging the status quo. However, international staff can dare to raise delicate issues as their professional career is not as dependent on their current position.